Hi, everyone. This is another interview on Vegan with Jenn, and today's guest is my friend, Dr. Ann Nguyen Chung. Dr. Ann is a dentist with a passion for contributing toward the health and wellness of others. Her hope is to inspire many to achieve optimum overall health, which includes physical, mental, and spiritual, ultimately to help maximize a more purposeful and fulfilling life. And she's been vegan now for around 3 years. And today we are so grateful to her for sharing her personal vegan journey and how she was able to reverse multiple chronic diseases in her own life by changing her diet. And we'll be ending with a discussion on diet and dental health. So welcome, Dr. Ann. Thank you so much for being here.
Thank you so much, Jennifer, for having me on the channel. I'm very
Of
honored.
course. So let's jump right in. So to give us a background, can you describe the diet you were consuming before going plant-based?
Absolutely. Gosh, my diet was very poor. I ate a lot of processed breads, cereals, crackers. Cheese was my staple.
Mhm.
During my dental schooling as well as my master's program, I just basically ate whatever was convenient and quick. And so oftentimes that meant going through the drive-through, getting chicken tacos. So very poor. In terms of vegetables, fruits and vegetables, I rarely ate them. I would say if I had vegetables, it just came with my dish or it was a very small percentage of my
Mhm.
actual meal. I said again, dairy and cheese were my staple. I ate that a lot. It was my favorite. So,
Mhm.
yep.
Yeah. And so what did your health look like when you were on that diet?
I had, I would say eczema, severe plaque psoriasis, irritable bowel syndrome. I would say the eczema I started noticing in my early 20s. The psoriasis also in my 20s, and it became really bad towards the end of my 20s. In terms of irritable bowel syndrome, I noticed that in my late teens, and it just became worse and worse. I never really thought about diet as being, the contributing factors because I knew that I had family members who also struggled with this, and so I figured, oh
Mhm.
gosh, it's just genetics.
Right.
The right. So in terms of the hypertension, um, high cholesterol, and pre-diabetes. I actually didn't know that until about 4 or 5 years ago when I was diagnosed with these. I know that both my parents had
Mhm.
history of high cholesterol and right now they're on statins. My dad's side has history of diabetes, and so I figured, well, I'm young now, I'll worry about it later on. So yeah, lots of different things. I also had other inflammatory diseases, which, I realized, it was due to diet.
Right. Yeah, I'm so glad you're mentioning you thought it was genetics because your
Hmm.
family had it and you had no idea it was possibly your diet that could be contributing to this. And I
Right.
think a lot of people probably still think that, especially with things like heart disease and diabetes that
Hmm.
runs in so many families.
Yes.
But I'm sure all of that must have been difficult to deal with. And I know there are a lot of people listening who are struggling with those same things now. So I'm glad you're here talking about it and how you were
Mhm.
able to turn this around. So, when did you transition to a whole food plant based diet? And maybe you could share what prompted you to make that change?
Absolutely. Well, I like that you piggybacked on the genetics thing. I definitely don't want to discredit genetics because
Right.
my liver, for some reason, genetically, it does produce more cholesterol. But I'll go into that a little bit later. So how I became plant based was about 4 or 5 years ago when I decided to take the time to address my own health. I know it had been contributing towards patients' welfare, wellness, but then I noticed my health was definitely deteriorating. My gut health was just becoming to the point where I thought I had colon cancer. I was bleeding. I had constipation, diarrhea, and I'm like, oh, I better get this checked. And so the good news is I found out that I didn't have colon cancer, but it was just clogged up gut health. And it was when I had my blood labs done, and that was when I found out I did have prediabetes. I did have hyperlipidemia, high cholesterol, hypertension, stage 1, which I was surprised. I'm like, man, I'm young, and my blood pressure was kind of running at about 130. Systolic and diastolic was about 80, sometimes 85, up to 85, and that's definitely stage 1. And I was like, oh man, so I spoke with my primary care provider, and thankfully she is plant-based, and she recommended, hey, Anne, you might want to consider going on a plant-based vegan diet. And so because I had been eating so poorly up until that point, I figured, okay, well, you know what, I'm going to eat cleaner, which still included meat. The American Standard Diet recommends this. And so I was still eating what I considered was clean meats, lean chicken. I was eating cheese still. And so I did this, and I took my blood test 3 months later. It wasn't really changing. And I was like, you know what, I'm going to continue this diet. Maybe I'm going to incorporate more vegetables and fruits. And over the course of about a year, taking my labs a few times, it was not going down enough. And this was just so frustrating. And so I told my medical provider, I'm like, what the heck? I don't know. I'm eating better. I don't understand what's going on. And so she said, you know what, Anne, like I said before, I recommend that you go completely plant-based vegan, or you're going to eventually have to go on medications to control your cholesterol. So, and the diabetes thing. So that was when I started my journey. And Jennifer, I know I met you back in 2016. That was my first plantrition project, where the conference where they had a panel of physicians and healthcare practitioners who talked about different studies that prove that going on this plant-based diet can successfully not only prevent these chronic diseases, but also reverse them. And I was very encouraged. And so at that time I had started, going plant-based, and have noticed significant changes.
Yeah,
So,
that's fantastic too, that that your doctor told you about this, because usually it's the opposite.
Right.
The person finds veganism on their own, and their doctor's like, oh, I don't know about that. So that's really cool. Okay, so many people usually have difficulty in that transition stage when they're first starting to realize, like, I want to eat healthier. So I always like to ask more about how you transitioned once you decided that you want to do the whole food plant-based diet. Did you do it gradually, taking away the animal products, or all at once? What worked for you?
No, that's a great question. I would say my process was definitely gradual. So once I did commit to the plant-based diet, I still was incorporating a lot of oils in my cooking, vegan butter, because cheese, prior to being on this diet, was definitely my trigger. I love cheese. And so I was trying to find foods that reminded me of that. And actually, 3 months after going on this, what I thought was doing plant-based correctly, while still putting a lot of oils and butters in my food, my cholesterol level did not significantly change. And so what I learned was that I had to also eliminate a lot of the oils. We don't need that much. And so I learned different cooking styles. So I would say I probably became more vegetarian. I went from being omnivore to vegetarian to the whole food plant-based. And so later on, when I talk about the plant-based diet, I'm talking about the whole food, because a lot of vegan foods, as I learned, can be highly processed and full of sugars and salts, and that doesn't necessarily help with, when you have the building blocks of oils, it can still be the building blocks for cholesterol, which my liver unfortunately does make a lot. So when you eliminate that, I noticed it was a lot better.
Right. And I notice it's really not just about removing animal products from our diets, but also adding in the healthy plant-based foods. So if someone's on a diet and like a standard American diet where they're not eating a lot of fruits and vegetables, if you just remove the meat, that's only one step, right? We still have to add back in fruits and vegetables and whole grains instead of, vegan butters and vegan ice cream, things like that.
Right.
So when you were transitioning, where did you find your recipes? Did you take what you already eat and kind of veganize it, or how did that work?
Yeah, no, that's a great question. One of my best friends gave me a vegan cookbook, and so I started there. And but I noticed that this cookbook didn't have a lot of pictures, and I'm inspired by lots of pictures. So I'm very grateful for all my Instagram friends who put up amazing photos, because I would say I definitely take my inspiration from social media, from the internet, and I use whatever's at home, and I make it my own. And like you said, some things that I already, my favorite dishes, Asian cuisine, I just substitute the meat protein with tofu or lentils, or something else that is plant-based.
Yeah, awesome. All right. So after going vegan, you experienced numerous health benefits. And when I say vegan, I mean the whole food, plant-based diet.
Yes.
And you avoided these medications. Can you share with us, just exactly how your health changed after you adopted this whole food plant-based diet?
Yeah, absolutely. I would say about a month after really eating, like you said, the whole food plant-based diet, my bloating initially was bad because of the fiber intake I was eating. But then about a month, everything was regular. I'm like, oh my gosh, this is amazing, because you're talking to a person who had such severe irritable bowel syndrome, where sometimes it was just so painful that I couldn't stand because of the bloating. So super regular, amazing. I would say the eczema took a little bit longer. I didn't notice it until maybe nearly a year after. So I had just itchiness on my extremities, my face, my body, and that took a little bit longer. I'm sure with people, everyone, it's different.
Yeah.
The plaque psoriasis has significantly gotten better. I wouldn't say it's gone away yet. I know it's an autoimmune thing, and it could be other factors contributing to that. Stress is one, and that's another topic. But I definitely have noticed a huge significance in the psoriasis decreasing in size as well as severity. Now, in terms of my labs, my blood pressure completely normal. I would say before it was about 130 over 80, sometimes 85. Now it's like 110 or lower for systolic, and diastolic is 67 or under. So huge changes there. My overall cholesterol did decrease by 50 points. It is still towards the higher range of the normal, but overall, I mean, what we're looking for is a decrease in LDL, which is the bad cholesterol, an increase in the HDL, and overall the triglycerides went down. And then I'm no more pre-diabetic. So all that is normal now. Yeah. So more energy too.
That's so awesome. And so the irritable bowel syndrome, that took how long?
I knew, like I said, once going on the truly whole plant-based diet, I would say it took me a month.
Wow.
Where it was,
and that was something you had from your teens, you said?
Yes. Yes.
So that's just incredible to
Yes.
me that people might have these conditions for years and
Mhm.
years, and then after going plant-based, you know, a month,
Yes.
or even if it took a year for something to resolve, if you had that for 10 years, I mean,
Yeah.
that seems incredible to me that our bodies can just naturally, you know, resolve these issues on their own just by changing the diet after
Yes.
having them for so long. Yeah.
It's amazing.
So that's crazy. And I also have the photos that you shared with
Oh,
me
yes.
to share with everyone. So I'm just going to pull this up really quick.
Look.
And feel free to comment on your experience with this. I've found that a lot of people find it easy to lose weight without even trying it. Just even if you're not doing it to lose weight, it tends to be like a side effect.
Yeah, no, thanks for the reminder. I know prior to this conversation, I had talked about weight loss as a natural side effect. I wasn't even trying to lose weight. But the first picture you see is a picture from 2009, I believe. Yeah, summer of 2009. And then this picture was from this summer. So I definitely lost a lot of weight, which, I just feel better overall, just more energy. And I think, I don't know, just being able to eliminate all the toxins from all the years in my intestines, I think that was
Mhm.
just really amazing. So thank you for bringing
Yeah,
that up.
of course. Thank you so much for sharing it with us.
Absolutely.
Yeah, I think it's nice when we're on this whole food plant-based diet. You can eat until you're full, until you feel satisfied when you're eating these foods in their natural states, and then you have all of these benefits.
Absolutely.
Yeah. So let's talk a little bit more about your diet. I want to get into the specifics of like what kind of foods do you eat?
Absolutely. I would say my staple has been rice and beans because both my husband and I have pretty busy schedules. We work pretty long hours and get home late. So we pre make rice and beans, and we'll always have, a bunch of greens, whether it be cabbage, mixed greens. We also like to roast vegetables. In our air fryer, which is super
Mhm.
fast to do. The Instant Pot has been a great meal prep kitchen appliance for us.
Mhm.
I do eat a lot of cauliflower, broccoli, just, yeah, anything you can roast in the oven.
Mhm.
I try to eliminate oils as much as possible. Sometimes it's hard to do, but I mean, it's been a lot less than before. I use a lot of spices because I
Mhm.
want to, minimize the salt intake. So, yeah, anything just intact. I do right now because it's winter. I have been making a lot of vegetable soups in
Mhm.
my Instant Pot, just various vegetables, kale, lentils, beans. Yeah.
All of that sounds good. What about for breakfast?
Okay, so breakfast, I mean, it's basically the same every day. My husband and I have oatmeal. We have
Mhm.
blueberries, walnuts with it. Sometimes a little bit of almond butter.
Mhm. Okay.
And
And what about snacks? Do you snack throughout the day?
um, I'll not really.
Okay.
Yeah. I sometimes I'll have like maybe nuts on the side just to, if my stomach's growling in my patient's ear.
Mhm.
Oh no, I better eat something so it doesn't bother my patient. But yeah, I not too much, not too many snacks.
Okay. Yeah. Well, the food on your Instagram looks so good.
Ah, thanks.
Every time I look at it, I'm like, oh, you should post the recipes so we can make it.
Yes.
um, and before we move on to the last topic, I'm wondering if your like family and friends are plant-based, or if you could share some tips on maybe eating out or having get-togethers with family and friends.
Yes. So in the beginning, this was pretty tough because
Mm-hmm.
my family members didn't really understand what I was trying to do. They said, "Oh, you should you can eat this. And in our culture, it's considered, for some of my family members, if I don't eat it, it's disrespectful. But thankfully, I would gently tell them, hey, it's for my health reasons. And thankfully they were really understanding. I will say I will just kind of eat it out of respect in the
Mm-hmm.
beginning. But now most of my family and friends know that I am more plant-based. And so they have been making dishes and substituting the meat with tofu. And I'll also offer to bring a dish of my own, like a salad
Mm-hmm.
or a vegan dish. And so it hasn't been too bad in terms of going to restaurants, which hasn't been an issue lately because of the pandemic and
Right.
lockdown. But that's easy. I would just order something vegan on the menu. And then in terms of get-togethers at friends' houses, maybe they might not know. Like I said, I'll bring a dish, and
Mm-hmm.
sometimes, occasionally, I will have someone who plops a food on on my plate. I'll explain to them, hey, I thank you so much, and try to be as polite as possible. But it's tough because on one end, relationships, I do, I it's one of those things where I you just have to tell them in advance, and sometimes if
Mm-hmm.
someone forgets, I'll remind them, and if they insist, I will just eat it,
Mm-hmm.
just respectful, out of courtesy, respect. And if someone makes me maybe a birthday cake and it does have milk and eggs in it, I won't decline it. The key thing is, if your diet mostly consists, your lifestyle, if it consists of primarily plant-based whole foods, I think that's awesome. So it's a tough one,
Yeah. I think the social aspect is a big barrier for a lot of people.
yeah.
I remember I was talking to someone once and they're like, oh, I can't go vegan because, when I go to people's houses, I don't want to decline. And I said, well, why don't you just go vegan except for when you're in that situation,
Mhm.
instead of using these things as like reasons not to do it.
Yeah.
If we just embrace it, and it turns out over time, usually people start to know you as um, the vegan or the whole
Yeah.
food plant-based.
Right.
Yeah, but it is a barrier when you don't want to disrespect somebody when
Right.
they've made you something. And I think the biggest thing is in the beginning, before people know that you're making this change. But I
Mhm.
like what you said about just being polite, letting them know you're doing it for your health, and that
Mhm.
you don't mean any disrespect. Yeah.
Right.
Yeah. But thank you for that.
Yeah.
So let's talk about your practice. So do you incorporate plant-based nutrition into your dental practice?
I absolutely do. I because although I regret not knowing about the plant-based whole food diet sooner, because I've
Mhm.
gone through this walk, I'm more convinced. And so I work at a clinic, and most of my, unfortunately, for the demographics that I work with, we do see a high rate of obesity,
Mhm.
other morbidities like diabetes, chronic health, heart diseases. And there's definitely a correlation between that and
Mhm.
caries, tooth decay, as well as periodontal disease, which is the number one reason for tooth loss. So when a patient comes in for an exam, actually for exam or any dental procedure, we go over medical history as well as we take their blood pressure. And the reason why we take blood pressure is because most of our anesthetics have epinephrine in it, and epinephrine can um, increase heart rate, which for people who are hypertensive, this
Mhm.
can increase their risk of heart and stroke in the chair. And so when I notice an elevated blood pressure, um, And of course, blood pressure, that only tells you one thing. It could be lots of reasons. It could be dental anxiety. They're not looking forward to getting that injection.
Right.
It's understandable, which is why it's important that I ask the right questions. Hey, if they've never been diagnosed with hypertension before, they'll usually admit, yeah, I'm nervous, doctor. Or, I ask them if they had caffeine right before the procedure, or if they ran up a flight of stairs. And if those aren't the case, and I notice, hey, you've never been diagnosed, or on the medical history, I also see if they write down a history of high cholesterol or diabetes. And so that's when I open up the conversation and say,
Mhm.
hey, Miss Susan, I noticed that you have this on your medical history, and maybe you've been diagnosed with hypertension or maybe not, but that's when I open up and I ask them about their lifestyle, their nutrition, and I educate them right
Mhm.
then, right then. And so blood pressure is one aspect. Of course, it definitely, you want to be careful because of the anesthetics that we use, also the medications that we prescribe, some things
Mhm.
that might counteract badly with the medication that they're taking. So that's one area. When we're doing the oral cancer screenings, I check for things such as acid erosion, plaque buildup,
Mhm.
and that is definitely directly related to diet. For patients who eat a diet high in simple carbohydrates, such as processed breads, crackers, I'll notice, a high level of plaque, which contributes to dental cavities. And so,
Mhm.
again, I'll educate them on, plant-based versus eating these processed foods. It can increase your chances of getting cavities.
Mhm.
Likewise, periodontal disease, like I said earlier, this is the number one reason for tooth loss. A lot of my patients say, hey, doctor, my parents lost their teeth at an early age, and so I think I'm going to too, because it's genetic. Or I'll hear, it's due to age, I'm going to lose my teeth anyway. Well, unfortunately, that's actually, there is some truth to that, maybe a small percentage that genetics can play a role in that, but it's really the
Mhm.
bacteria, and certain foods that we eat promote certain bacteria in our mouth. And so as our gut, we have good bacteria, we have bad bacteria, and depending on the foods that we eat also promotes that. So there was actually a couple studies I found that showed that the difference between the microbiome in one's saliva, they used vegans versus someone on um, an omnivorous diet, and they found that
Mhm.
people who were vegans generally ate more dietary fiber, and that fiber promotes a certain bacteria in the mouth. And in another
Hmm.
previous study showed that this bacteria, the fiber, there's a link between fiber and decreasing the rate of periodontal disease. And so it's just so fascinating. And I know
Wow.
there's a lot more research, and I I feel like there should be more. And I think that as we continue to get more awareness on this, people will realize not only does it affect the gut biome, overall health, but whatever we put in our mouth, that's just the start of your overall wellness, because what we ingest, everything's connected. The microbiome in the gut, the mouth, it's
Mhm.
cool. So
No,
yeah.
that is really cool because I hear all the time about how diet affects the gut microbiome, and I would love to see those studies that you're talking about with microbiome in the mouth. I think that's so
Yeah,
cool. It's really crazy how diet can affect so many things. I mean, just from our conversation, we're hearing the microbiome, diabetes, heart health, gut health, even skin conditions, and
mhm,
dental health. So
yes,
diet is just so important in so many ways.
absolutely. I forgot to mention too, the
Mhm.
pH thing in plant-based. for example, like if you look at cow milk versus plant-based milks, I found very interesting that, well, first of all, let me go back a little bit, like take a step back. So we know that there's a pH scale that goes from 0 to 14. Neutral is pH of 7. Our enamel, what I've seen a lot of acid erosion is sometimes due to diet, but it's all, sometimes it's due to acid reflux and that sort of thing. But the pH level that dissolves enamel is 5.5. And when you eat processed foods, a lot of those processed foods, those sodas, dairy, they're acidic. And in terms of plant-based, when you drink the plant-based milks, they're neutral, and sometimes they're even more alkalinic. Grains are alkalinic. Now, not saying that all plants are alkalinic, because fruit juices and that sort of thing, that can cause acid erosion too. But overall, like, they've seen that people on a plant-based, what I've seen in my own patients, I ask them, hey, are you plant-based? And I do have a few patients who do that, and I've noticed a difference between the teeth wear. So anyway,
wow, no, that's so cool. Yeah. Thank you for sharing.
Absolutely.
Wow. So this has been so wonderful talking with you. Thank you so much. And thank you everyone for watching. And please check out Dr. Ann Nguyen Chung on social media. I will link it in the description box below. She has a YouTube, and she also started a new business recently. If you want to tell us briefly about that before we end.
Sure. So really quickly, during the pandemic, it's kind of unrelated, but I started developing a rash on my face, and I sought help from a dermatologist, and he thought it might have been perioral dermatitis. So he put me on medications. Unfortunately, it didn't go away, and I started eliminating different products, and I noticed that long story short, it ended up being a lip balm that I had that had all these different ingredients in it. And once I eliminated that, my rash went away. And so it turned out that I did have a negative reaction, an allergic reaction to that lip balm. And so it's, interestingly enough, it's been a journey to, in terms of being plant-based lifestyle, which not only includes the foods that we ingest, but also the skincare, the materials that we put on our skin, because our body absorbs it. And so I had made my own lotions at home before that are made of natural products, but I kind of started experimenting a little bit during the pandemic, and I said, you know what, this is kind of fun. I decided to brand it, and silly. It has a hippo as my logo, because hippos are herbivores, and I just think they're cute. So it's called Happy Hippo Plant Organics. It's all vegan, all plant-based, minimal natural ingredients. I use cocoa butter, shea butter, coconut oil, just really natural ingredients, and you won't have to worry about.
Your packaging is so cute. I love it.
It's just fun, and I wanted to be responsible, because as I started learning about this plant-based lifestyle, I learned how the environment gets ruined by these dairy farms and how animals are treated. And so I wanted to develop a company not only was vegan but also environmentally friendly. And so I try to use biodegradable packaging. So these are actually craft tubes. They're biodegradable, they're push up. And since I'm a dentist, I wanted to incorporate dental products. So it's a bamboo.
I love that.
And it has all natural, plastic-free toothpaste and biodegradable dental floss on the way. So that's to be soon. So
awesome. I use a bamboo toothbrush too. So my next one I'll buy from you. That's super cool. Yeah, congratulations on that. Everybody check it out. Happy Hippo Plant Organics.
Yes, ma'am.
Yes. Okay. Very cool. And I love how a lot of people that I talk to who start the vegan diet for health, then they start to change the products they use. They start to be more interested in the environment and how animals are treated. And it's just so eye-opening.
Yes.
Yeah.
Absolutely.
So very cool. So thank you so much for being on my channel, for sharing your story, for sharing this life-changing message. And I hope everyone enjoyed this video. Thanks for watching A Vegan with Jenn. Bye.